Okay, so today we're going to be talking about something that a lot of people know as ADHD. So, ADHD stands for Attention Deficit Hyperactivity Disorder. So, let's start by talking about what is ADHD. So, ADHD is a neurodevelopment disorder that is usually found in children. And this disorder is one that usually lasts throughout adulthood. So, a lot of the adults that currently have ADHD were diagnosed when they were children. So, students with this disorder, they usually have a difference in their brain development and brain activity. Although we do not know what the cause for ADHD is, research has shown that a lot of different factors play a part into it, and genetics is one of the biggest factors. So let's talk about the difference between ADD and ADHD because these are two terms that are used very interchangeably. So when we talk about the term ADD, we are talking about attention deficit disorder. And students with this disorder, they usually have difficulty with paying attention and completing tasks for long periods of time. Versus students with ADHD, these students also have that inattentive symptoms and display it, but along with that, they also have difficulty with hyperactivity and impulsivity, meaning that they are quick to perform tasks or actions without thinking, and they constantly have to be moving. So there are three different types of ADHD. So the first type is predominantly inattentive presentation. So that's kind of the ADD that I just kind of talked about. So when research, they kind of pulled away from using ADHD and just put it as a form of ADHD. So these individuals, they usually get easily distracted when they are completing tasks. And it's difficult for them to complete tasks for long periods of time. So sometimes they may need breaks when they're completing assignments or tasks. And a lot of times you would think that these students are daydreaming when really they just have a hard time focusing. And this is the hardest ADHD form to detect because the symptoms aren't as severe. So students who have this type, they do not show any symptoms of hyperactivity. But then you have the predominantly hyperactive and impulsive presentation, which again, these students, they constantly have to be moving and they perform a lot of tasks without thinking first. So that might be like them raising their hand or speaking out when it isn't their turn. But these students do not show the inattentive symptoms. Or the most common form that students have is the combined presentation. So meaning that they display those inattentive symptoms, but also the hyperactivity symptoms at the same time. So let's talk a little bit about what this may look like in the classroom and what students may be doing. So if students are predominantly inattentive, so a few symptoms that they may have is they may be a little disorganized. They may tend to lack focus. Again, that's the can't stay on task for long periods of time. Difficulty giving attention to details or having trouble staying on topic for long periods of time. So again, this may mean needing to take a break while completing activities. So that may mean working for 10 minutes and then taking a break for 2. The hyperactivity is the constant moving. So you might see students fidgeting or squirming or tapping or shaking their leg in their seat. They may need to get up and walk around or run just to kind of let the energy out that they have, or they may have trouble playing quietly and doing different tasks that they're assigned. And then the impulsivity comes with the difficulty of sometimes not thinking before students perform tasks. Sometimes students can be impatient. They can have a hard time waiting on their turn. And so they might blurt out answers or speak when others are talking because they just feel like they have to get it out right then and there. So ADHD, the symptoms may look a little different in boys versus our girls. So, if we look at our girls first, we see that a lot of times in girls, we tend to have that daydreaming symptom. So, kind of just in a gaze, looking around, not necessarily um, being focused. But girls also tend to show lower self esteem rates and tend to show more anxiety in their tasks, and they're verbally aggressive or name calling, and sometimes they can show that they're withdrawn. Versus as boys with ADHD, they tend to act out more physically um, with their symptoms. So, how is ADHD diagnosed? So, first, ADHD can only be diagnosed by a medical professional. So, that includes a pediatrician, a psychiatrist, or any type of medical professional. So, three things that they look at when diagnosing ADHD is first the clinical psychosocial assessment. So this is a group of assessments that the professionals perform to gather information. And then they take that information and they look at the diagnosis from the DSM-5 to compare what information they have gathered. For ADHD, a student has have to shown symptoms for at least 6 months. So they also look at the developmental and psychiatric history. So they may gather the students' medical records and also look at their family history to see if any of the symptoms or signs that they are showing for ADHD is connected to another medical condition that they have maybe had in the past. And lastly, they look at observer reports. So this includes getting people like the students' teachers, so you all, or other people who are around the students for a large portion of time to complete forms that talks about their behavior on a daily basis. And as a teacher, most of the time, you will be the one filling out this form. So it's going to ask you, does the student do this or does the student do that on an everyday basis? So treatment. ADHD is not something that can be necessarily cured, but there are ways that you can lower the symptoms. So, of course, there's medication. So, students can take medicine to just kind of reduce their symptoms and their feelings of ADHD. They can participate in behavior therapy. So, that may look like talking about social skills. They can also conduct counseling with a counselor to just kind of talk the ADHD through and maybe what the student is feeling, and also different educational services, which is where you as the teacher would come in.
So now we're going to transition into talking about some of the statistics revolving around children that have ADHD. So currently there are 6.1 million children in the United States that have been diagnosed with ADHD. Like Makila mentioned earlier, a proper or a common treatment that is used for ADHD is a medical stimulant. And 2 out of every 3 children are currently on medication for ADHD, and 64% of children have ADHD in conjunction with another disorder. Students that have ADHD tend to struggle with anxiety, depression, some are autistic, and a common symptom that is associated with ADHD is having behavioral issues. And that tends to appear in 54% of children that have ADHD. So these are the prevalence of ADHD by the numbers broken down by the severity, gender, and race. So starting with severity, by that we just mean like whether they have it on a very intense level or if it's just moderate. So as you can see by the first graph in the magenta color, the majority of students that have ADHD have either mild or moderate cases. So there are very few students that have it at a very extreme level. And in those instances, that's when you have additional staff personnel assisting the student in the class, and they're receiving special accommodations. we talked about earlier how the symptoms of ADHD appear differently in males and females. And referring to this chart, you can see that ADHD is more prevalent in males and females. Doesn't mean that it's not prevalent in females, but it just tends to show up more in males. And research has shown that Black and Hispanic children tend to have more cases of ADHD diagnosed compared to their Caucasian counterparts. Like I mentioned earlier, while ADHD is present in both males and females, males are 3 times more likely to be diagnosed with ADHD, as well as children from primary English-speaking households are 4 times more likely to be diagnosed with a disorder. Children living 2 times below the poverty level have an increased risk of developing ADHD. So why does this matter? Why do we as educators care? Why do we as counselors care, administrators? Why is this topic of ADHD and how it affects children important? Well, one, children with ADHD have a hard time focusing, and this may be misinterpreted as their unwillingness to learn. There's this label and stigma that children with ADHD are lazy and aren't interested in school, and that's actually false. This hyperactivity may be affecting their ability to learn and may also be contributing to their behavior. So it's very important that we recognize what exactly it is that's impacting the child, and that we prevent giving stigmas and labeling students based on what they're struggling with. Additionally, as mentioned earlier, students with ADHD also have experiencing anxiety and depression, so it may coincide with other developmental and mental health issues as well. So let's talk about some of the myths that are surrounding ADHD. We already addressed one, that it only affects boys. That's not true. Girls have shown incidences of having ADHD as well. It's not real. Some people out there believe that, children just have a lot of energy, you give them sugar and they're hyped up, and that ADHD is not a real thing, that children are just young, they're vibrant, have a lot of energy. It's not real. Well, that is a myth. ADHD is in fact a mental health disorder. Another common misconception is that children will outgrow it. 4% of adults currently have ADHD, so it's not something that children outgrow. I think that, well, according to research, children learn how to manage it and how to focus and be more mindful of their behavior as they grow up. But it's not like as they age that the ADHD just goes away. Another myth is that children having ADHD is a result of bad parenting and that parents just aren't disciplining their children enough. That is very incorrect. ADHD is a result of brain development, and so therefore, you can have a perfect parent and still have their children develop ADHD, or you could have a parent that isn't perfect, quote unquote, and have no symptoms of ADHD. So it has no relationship to the quality of parenting that the child is receiving. And children that have ADHD are lazy. So this hyperactivity is affecting their ability to focus. And it's not that they do not have the desire to learn, but rather just needing an outlet to kind of release that energy and need a little bit more help with focusing. So what can a school counselor do to help students with ADHD? So there are a lot of evidence-based interventions to help children with ADHD. One of them we kind of mentioned earlier was the use of stimulant medication. The most effective form of treatment for students with ADHD is when parents and teachers are working together and making sure that the same stability that we're providing at home is being provided at school. So as a school counselor, we are here to be a resource for parents and kind of bridge the gaps between the administration and the teachers at the school and the parents at home. We are able to use mindfulness lessons and kind of help children focus, organize themselves, develop better time management skills, as well as process their feelings. Another thing that we can do in terms of lesson planning is really work with our students on how to advocate for themselves. As educators, we like to think that we are going to look out for the best needs of our students, and that, you know, unfortunately, we just can't look out for them for the rest of their life. You know, we only get a short period of time to spend with them. However, we can teach students as school counselors to advocate for themselves. So when they get to the collegiate level and further on up, that they will know, you know, I need these accommodations, and they will know how to advocate for themselves and what they need based on them having ADHD. Regarding accommodations, as a school counselor, we are not a part, or we are not solely responsible for 504 and IEP plans. However, we may be a part of the school accommodations team, so just being there to support that process and making sure that if your student has ADHD, that they are plans set forth in place to make sure that they receive extra time on tests and things of that nature that may assist them and help them to focus. Advocating for students with ADHD is a really important role of a school counselor. Small group sessions, again, talking about those same topics of focusing, organization, time management, and lastly, but certainly not least, what we're doing right now, which is providing professional development for you all so that you can better understand ADHD as well as how you can support your students. So we talked about what we as counselors can do to help students with ADHD, but now we're going to shift our focus to what teachers can do to support students with ADHD within their classroom. One, attending professional development and training so that you can better understand the needs and what's going on with students with ADHD is very important. So I really do appreciate you all being here today, as well as just exercising patience. I know it goes without saying, but you know, students with ADHD really are trying, and just giving them that extra grace and patience to know that, like, mindful of what they're experiencing and giving them that space to learn themselves and process what they're going through. Another thing that you as a teacher can do in the classroom is to reinforce positive behaviors. So if little Johnny is focusing, if little Johnny raised his hand and didn't have an outburst, kind of rewarding those behaviors to send the message that, you know, this is how we are supposed to conduct ourselves in class. Good job for doing that. Implementing breaks throughout classes when possible. I know that, you know, we want to use every single minute of teaching for instructional time, but you can just, for students with ADHD, give them the opportunity to take a body break and kind of release some of that energy and fidget and get a move in. This helps with students breaking up the work into smaller sections and helping them to focus a little bit better. Another way to help students is to provide structure in the class. Alternative seating is another option. So I know we all love our trendy Pinterest colorful classrooms. However, sometimes these bright colors and words and pictures and graphics can be distracting to students that have ADHD. So maybe providing them seating that in the room where there's minimal distractions and minimal wall art and things, as well as maybe even placing them at a desk that is close to you, is another thing that you can do. And lastly, just active engagement. This applies for students with ADHD, but really for all students. So, you know, involving them in the learning process, giving them tactile things that they can touch and see, you know, get up and down, group activities, opportunities to interact with their peers are all ways to keep students with ADHD engaged, and this involvement in learning can help them focus more on the content being learned in class. So some additional information that we want to share with you all. So there's two professional organizations. One, the Attention Deficit Disorder Association, is a great resource for teachers to reference if you have questions regarding the symptoms, the treatment, diagnosis, anything that we shared in this presentation. The Attention Deficit Disorder Association has a great website that goes in much more depth than what we did, and is a great resource for you to use, as well as the children and adults with attention deficit hyperactivity disorder is another great source. Both of these resources offer professional development classes that you can take that provide additional assistance in how to better support students with ADHD and provide just general information that I think is helpful. And lastly, but certainly not least, October is ADHD Awareness Month. So as teachers and administrators and school counselors, really taking the time in the month of October to bring awareness to ADHD and how we as educators can advocate for our students to make sure that, students with ADHD are treated fairly, that there are equitable resources and accommodations to make sure that they succeed. And that is all we have for you today. Are there any questions?